and today we are going to discuss the indications and the goals for the range of motion. Basically, starting from the passive range of motion, the major indications include the use. Basically, the indications of passive ROM is how they can use in an acute inflamed tissues where active motions may be harmful. Okay, like after post injury or post surgery, for in a 1 week. Okay, like here you can see 2 to 6 days of the duration, but in a 1 week you can just give a passive range of motion in a starting, or you can say that the post operative 1 week. Okay, or the post injury 1 week. Second one was that the applied when a patient cannot or should not move actively, like in a condition like stroke, in a paralysis, in a coma, in a bed rest, that when the patient is completely bedridden. In these kind of condition, the patient cannot move itself, so you have to give the passive range of motion exercise. After that, there are certain goals that you have to achieve normally. Okay, so from the very first, you have to prevent complications of immobilizations. First, you have to prevent any further complications that is related to the immobilization, like cartilage degeneration, adhesions, contractures, and the sluggish circulation. These kind of basically complications you have to prevent first, and after that you can just work on another things. So contractures are majorly developed in stroke patients. You have seen adhesions are seen like that majorly because there are many kinds of strokes, and in that there are many kind of degenerations and adhesions contractures are developed. So you have to work on them first to prevent any of the further complications. After that, you are going to maintain joint and connective tissue mobility with the passive range of motions. Okay, so you have to work on the joint and the connective tissues to basically immobilize. They are basically before starting any passive range of motion, the joint is immobilized. Okay, so you have to work on the mobility to maintain any of the joint or connective tissue. Now you have to only maintain. Okay, you cannot further stretch or increase the joint or connective tissue mobility. You just have to work to maintain that joint or connective tissue mobility. After that, you have to preserve some muscle elasticity. So majorly, as you can see in your book, there are many of the other things, but you have to maintain mechanical elasticity of muscles. Okay, so majorly when you can work on these kind of patients, there are many other things that are involving in there. So majorly the patients have plasticity, or you can say that the spasticity, flaccidity. There are many other things. Okay, so you have to discuss first these kind of things, and these very individual to individual, that what kind of goals you have to achieve first and what kind of goals you have to achieve on the later stages. So in basically these are all the goals. You have to select certain, and you have to decide what is important in this patient or what is important in my patient. Okay, so preserve muscle elasticity. After that, you can basically assess circulation and vascular dynamics. Basically, you can just perform certain movements like ankle pumping, like heel slides. You can just assist in a certain ranges, that flexion extension ranges of the foot, basically ankle joint, knee joint, hip joint, shoulder, elbow, to assist in a circulation and vascular dynamics. After that, you can enhance the synovial movement, as you have know that we are working on the synovial movement as well, because you are moving the joint, so synovial fluid itself move, synovial membranes move, basically the joint cavity is completely in a mobile position. So when you can work on these kind of conditions, basically the cartilage nutrition is basically enhanced, or you can say that the increase in the cartilage nutrition, and you can just remove the further waste products. It also decreases or inhibit pain, as you know that movement in a early stages, like after the post injury or post surgery. If the you can just work on the patient's mobility, it can decrease or inhibit the pain mechanism, the pain gate theory pathway. So you have to work on that. It also helps in post injury or post surgical healing, because you know that it has the healing properties. When you can work on the passive range of motions, or when you can perform the passive range of motion, it assists in healing process. Okay, it is really working. It can really affect the early stages, or you can say that the early healing processes after any injury or after any surgery. Okay, after that, it helps to maintain the patient's awareness of movement, like how you can maintain the patient's movement, and you have to tell and you have to array the patient according to that, that it is a long process. You have to work with us. You have to basically activate your own mechanism. You have to achieve your goals. You have to motivate the patient in a way that you have to encourage a patient. You can aware a patient that even if you can, even if it take times, but it can really increase your movement, or it can really heal your injuries or the surgical scars or the surgical processes. So you have to work with us. Even if it in a starting, it can cause some kind of pain or a discomfort, but you have to work with us. You have to just discuss everything with the patient. So it can basically helpful for the patient herself. So other uses of passive range of motion is basically the assessing joint stability, motion limitations, and the tissue elasticity. Okay, you have to just assess start in a starting that passive range of motion is also used for the assessment purposes. You have to assess the joint stability, the motion limitations, the tissue elasticity. As you have know that there are certain special tests you are using in a diagnosis of the patients. So it is also used in a assessment processes, because in that you can just give the passive range of motion to complete certain movements. So it is very good point of view, or you can say that it is very good tool to assess any of the joint stability or the limitation with that tissue elasticity. You can also demonstrate movement in active exercise programs. With this, of course, you can demonstrate, you can just work, tell the patient itself that this is how you can perform this movement, or this is how you can just work on yourself, or this is the flexion of the shoulder. You have to perform like that completely. So you can just demonstrate on yourself, or you can just demonstrate on patient in a passive range of motion form. After that, preparing for the passive stretching techniques, you can also work on the passive stretching, of course, but you have to only prepare, okay? You cannot just include the passive stretching techniques into the passive range of motion exercises. You can just prepare your patient for the passive stretching techniques before starting any of these procedures, okay? Passive range of motion exercises are very helpful in the passive before to prepare any of the your patient for the passive stretching techniques, okay? After that, okay, now we can just scroll down. After that, active and active assistive range of motions. Okay, indications are basically it is used when a patient can actively contract muscles and move a segment independently or with assistance. Okay, so it involves the patient's muscles itself. So patient can contract itself. Patient muscles can contract their own self, or you can say that they are actively contracting their own muscles. And or sometimes patient segment can move in a just completing the degrees of 20 to 120 to 130 degree of the shoulder flexion. Okay, we can just take this an example. Okay, so you can just tell that the patient you have to perform the 160 or 180 degree shoulder flexion. This is how you can perform. But in a starting, you are going to see that the patient is stopped on the 120 to 130 degrees. So that means the patient needs some kind of assistance to complete the active range of motion or active assistive range of motion. So you can just assist a patient for further movement, because there are certain kind of weakness in his muscles. Okay, because active or active assistive range of motion is used for the weak muscles, in that they are unable to move a joint fully against gravity. So you can just assist them to function at a maximum capacity. Okay, active assisted are used for that. After that, it is basically used for the progression to the resistance exercise. As we have know that we are going to strengthen the muscle after the active range of motions are achieved, or the functional activities. So you can just give the starting in a with the passive range of motion. After that, the active assisted, then active, and after that you are going towards the resistant or the resistive exercises. So you can just say that this is the continuous process to achieve any of the areas or the functional activities. Also, help maintains conditioning of the body regions above and below an immobilized segment. That means you have to work on other body regions above and below any of the immobilized regions when using the crutches, because it is also important to maintain the full conditioning, or you can say that the because patient has to use the crutches, so there are some kind of strengthening also present on in his upper limbs. So you can just work on those segments as well to strengthen those muscles, or you can strengthen, or you can actively contracting those muscles to mobilize, so that patient can easily use their crutches without any discomfort. So you can just maintain the original body conditioning or original body regions as well. You cannot just work on that immobilized segment, you can work on other segments as well. Okay, you can just work on other limbs as well. Okay, you cannot just say that the left leg is affected so you can just work on the left leg. You have to work on all the four limbs, all the complete body, the trunk also involvement, the head also involved in that. So these are the complexes. Okay, now majorly these are the major things. So after that there are certain goals the active range of motion has to complete. Okay, so the goals that active range of motion has to achieve is similar benefits as the passive range of motion if no inflammation or contraindication exists. Okay, majorly benefits are same like that. Also includes to maintain muscle elasticity and contractility, because in this the contractility is also the vital component in the active range of motion, because patient or person can contract his muscle on its own. After that, provide sensory feedback from muscle contraction, because it is very helpful. Okay, it also gives the sensory feedback because you can activate the sensory nerves, sensory endings, or everything related to the muscles they on their point motor units. You can activate all the motor units, so it can just give a very good or in a very comprehensive sensory feedback to your brain while contracting the muscles. Okay, it can also stimulate bone and joint integrity, because it is the active range of motion. Of course, it can stimulate your bone and joint also itself, your completely joint integrity, the all the components that are present, the ligaments, the joint capsules, the muscles, the cartilages, all are included in that. They are going to stimulate the complete bone structures. Okay, it also improves circulation and prevent thrombus formation. It is very important. Okay, it can improve the circulation and it also prevent the thrombus formation. That is the major key factors for the development of DVT. As you know that deep vein thrombosis. Thrombus is basically the clot. Okay, as you know that. So if that clot is basically formed, it is basically the very dangerous one. Okay, it can become embolus, it can go towards your pulmonary arteries, and it can damage your or it can block your circulations, called causes occlusions, or basically causes strokes and causes many other conditions like you know that the pulmonary embolism, and it can just go anywhere and it can damage anything. Okay, so the you have to work on the prevention of thrombus to basically prevent any of the complications that are in the future that our patient has to face in the future. So you have to work on the circulation in a very serious way. Okay, after that develops coordination and the motor skills for the functional activities. So develop coordination and the motor skills are very important, because you know that it works on the coordination because it is the active. So active range of motions are the basically you know that we have discussed the sensory feedback before. So it is very important when you can activate any of the motor units. It can activate your central nervous system, it can activate your cerebellum, it can increase your motor skills, it can basically increases any of the functional activities. It can very helpful to achieve your ADLs, basically activities of daily livings. So you have to work on these goals. Okay, so these are the very important major goals of the active range of motion. After that, there are certain limitations that you have to see here. The limitations of the passive motion is basically, you know that when the patient is conscious, it is also itself is a very issue, because patient cannot basically cannot give a consent, or you can say the patient is not tolerable. So it cannot you cannot perform in passive range of motion in a very easy way. Okay, you have to go through a very difficult process to achieve that passive range of motion, because patient is not used to that movement. Okay, so passive motion, because passive motion does not prevent muscle atrophy, that is muscle you know that the muscle cells can dead itself in a muscle atrophy. So you have to prevent muscle atrophy, you have to increase strength or endurance, you have to assist in circulation to the extent that active voluntary muscle contraction does. So you have to work on all of these things, because because you know that the passive motion cannot do these kind of things. So you have to do some other movements or some other exercises to work on these. But if you cannot achieve the passive range of motion, how can you achieve these things? Okay, so you have to work on that. You have to achieve passive motion first, and after that you have to, because limitation mean doesn't mean that the other exercises cannot do. Limitations mean passive range of motion cannot do these things. Okay, other exercises can do these things, but limitation that means that passive range of motions cannot use these things. cannot basically achieve these things. Okay. And active range of motion, basically for strong muscles, active range of motion does not maintain or increase strength, as you know that. It cannot increase strength. It can also it can just work on the movement. Okay, it cannot increase the strength or maintain the strength. Okay. And other than that, it also does not develop skill or coordination except in the movement patterns. As we have discussed, movement patterns is basically developed in the active range of motion, but you cannot develop any of the skill or coordination with the active range of motion. You have to increase patient strength, you have to develop patterns, you have to work on specific patterns to achieve skills of coordination. You have to activate the cerebellum, okay, to achieve any of the coordination related issues. So you have to work on these, the active range of motion. So these are the limitations of passive and active range of motion. Thanks for watching. In the next lecture we're going to discuss the precaution and contraindication. So if you have a query, if you have any query, you can ask in the comment section below. And this is all.